Okay, so we've covered the day of surgery. Now we're going to focus on the day after surgery. And keep in mind, these are things that I tell my own patients, so other surgeons may have different viewpoints or may have different instructions, but this is things that I tell my patients in order to help optimize their recovery. Now, unless otherwise indicated in the post-operative orders, I like all my patients to start walking right away after surgery. And this may be crutch-assisted, or maybe cane-assisted, or there may be no ambulatory aids. But regardless, I like them to be moving after surgery, and this serves a number of purposes. So, number one, when they are moving post-operatively, we get an early start on their movement and restoration of their range of motion. Number two, the movement helps to get the muscular pump of the lower extremity working, so that we help to pump out any of the fluids that may have accumulated in the lower extremity following surgery, whether that be arthroscopy fluid or just post-operative swelling from the procedure itself. And lastly, the walking helps to minimize the chance of the patient developing deep vein thrombosis. Certainly, if you are immobilized or immobile after surgery, the blood can pool in the lower extremity, and your chance of suffering a deep vein thrombosis or a pulmonary embolus increases. So I like to get my patients walking right away. Also, depending on your symptoms, the patient needs to continue using their analgesic medication. And hopefully, over time, as time progresses from the surgery, the patient's analgesic requirements or pain medication requirements will decrease. When I advise them, I always try to encourage them to use the over-the-counter medications first to establish the baseline, and then to use the narcotics only as a breakthrough. And in this way, we're going to minimize some of the side effects that occur with the narcotic medication. So we continue our use of pain medication as is required, but hopefully in a fashion where we are gradually tapering that off. We also should continue with ice during this early rehabilitation period, but only as required to help with pain control and with swelling. But again, we don't want to use this too aggressively because, as stated previously, current literature is showing that with too much ice, you can actually cause cell necrosis or cell death. So we really want to use it relatively sparingly. And the last thing that we want to start to do on the first post-operative day is to start to work on movement of the joint. So we want to initiate our movement practice. And I'll talk a little bit more about the specifics of that later. But basically, we want to start doing exercises that are specifically designed to restore movement of the joint, because the quicker that you can restore movement, the better off you're going to, or the better your function will be, and the less likely you are to develop post-operative fibrosis or scarring after the surgery. So those are the main things that we want to think about on the first day following surgery.